I'm the medical director of infection control at MarinHealth, and I do clinical infectious diseases as well.
Are you also the head of the emergency department?
No, I'm an infectious disease doctor who's
Okay.
got public health training and training in hospital infection control.
Perfect. I had heard that you were also the ER head, but I'm delighted that you have the credentials that I needed to have to talk to you about this. I'm wondering what trajectory you think the Bay Area is on.
Well, we're all on the same trajectory in some ways, right? The entire planet. We're all in this together. I think that we are in pretty good shape right now compared to some other areas. I think that Governor Newsom, when I heard, we were in a planning meeting, and when he had the 7-county shelter in place, that was the best thing I heard in a while, because the really positive effects for that. So I think if we hadn't done that, we'd be much more like New York. And I appreciate that a lot when our leadership is listening to public health experts, even when it means significant economic impacts. But still, we're all the frontline hospitals, UCSF, CPMC, Stanford in particular, are just starting to feel a crunch that is not going to go away and probably get worse. So it's been very challenging. We have a lot of really resilient healthcare workers.
Dr. Tolliver, I think people would be interested in having an idea from you on how much worse it's going to get in the Bay Area.
Yeah, so it's pretty hard to tell because our surveillance for what you could think of as kind of an invisible attack in a way is not good because of the limited testing. So last week, Wednesday, we started our drive-through in Marin County in public health, and we got a sense of what the community level was. And so it could be a lot worse. And I think for sure the worst is yet to come. And it's really, we all want it for something to change, just get through this and then go back to normal life. But I'm not sure that's going to happen soon. And this is a slow moving disaster that in itself makes it hard to understand exactly where we're going to be at. But I feel pretty good about our Bay Area efforts to flatten the curve, and the state efforts to flatten the curve, as well as the county and city efforts.
Do you feel a 20% infection rate would be high? 30%?
Well, it depends on what time period you're talking about. So if we had 20% over the next 6 months, that would be great. But I think that it won't be that long of a time period, and that's the really hard thing to judge. So I was looking at some models today, and so the more we can spread out the infections over a year's time, the much better our acute access hospitals will be able to get through it. So it's all it's gradual right now, but as soon as testing ramps up, like next week, we're gonna have a lot more positive tests coming in. There'll be a bit more of concern. The skilled nursing facilities are going to be really challenged to take care of some of their patients. So there's a lot of work going on behind the scenes in healthcare organizations to prepare for that and to really shift modes.
The president said today that he's hopeful that the country can get back to work by Easter. It's 19 days from now.
Yeah. Well, I think that I'm a medical professional. I'm trained in public health. I think there's lots of things we can hope for. But I think if you look at the science right now, I think when other infectious disease doctors and public health experts heard that, they probably shuddered as well, like myself, because I just don't think that that is reasonable. And I'm hopeful actually that the president will um, realize over this time period before we get to Easter that that's not going to be an excellent option. Um, I suppose things can change. I can't predict the future, but that doesn't seem very feasible to me right now. It seems like a big risk, and I don't think we should be so concerned about the economy that we're putting lives at risk.
Is it possible for people to go back to work and still, as the president put it, maintain social distance, not shake hands? He seems to think that if you could stay 6 feet away from somebody and not shake their hands, that we should all go back to work.
Well, I agree that we should all try to go back to work, but I think that we need to redefine what that is and how we're going to work. And we already have, we're Zoom meeting, and I think everybody else is doing that in Skype meetings and WebEx. So certainly people need to go back to work, but I've got big concerns about packing a bunch of people into an office building, for example, everyone touching the buttons on the elevator. I think that's probably more risk than we can handle at this point in time. That would be safe because also the testing is so limited. You really don't know what someone's COVID-19 status is. There's asymptomatic carriers, etc.
He thinks that more people would die from suicide than would die from COVID-19. He said, look, we had 37,000 deaths last year from the flu. We had more people die in automobile accidents. Why are we get so wound up about COVID-19?
Well, it's probably 10 times more deadly than influenza, and influenza is a big deal. I don't buy the suicide idea. I haven't heard that from anyone else. It seems pretty scary when you say that. But I don't see why we shouldn't just continue as we are and adjust to a new normal for now until we get expert guidance from the Centers for Disease Control. And I'm just hoping that that'll be our guidance. That'll be our reality, is that we have experts in the field of infectious diseases and public health who are guiding policy. And that's how countries like Singapore and Korea have done well, is they had expert guidance all the way to the top.
When you look at this, knowing what you know about infectious disease spread, what's the time frame that would seem the most optimistic to you?
For what?
For being able to get back to some sort of normal.
Yeah. So I think going back to school by the end of the year is probably not going to happen. What I'm hopeful for is that if we continue to adjust our lives, social distancing, and warmer summer temperatures, that we'll get much closer to normal, and school won't be in session like around mid-July, so that we can get close to normal by the time school starts, and hopefully have a couple of months of school in session. That's kind of what I'm hoping for at this point. We'll have to see.
So you think that this shutdown is going to last until June anyway?
Yeah, I think it's going to be varying stages of that in social distancing for a while, knowing what I know about coronaviruses, immunity, how this virus and it spreads silently before people get symptoms. So it's not fun to say those things, but I think that we have to think about our family members, our older, more at-risk populations, and we're all in this together. So we all are going to be doing more work from home. and trying to find a way to be productive. And some businesses are really going to have trouble, especially if they're centered around entertainment, and sports. So I mean, I wanted to see Steph Curry get back on the court and see how that team would go. And I'm not so sure that we're going to be there in person for that.
Dr. Tolliver, what would be the danger of people going back to work if they maintain social distance? Now, you mentioned elevator buttons, and I can think of cooks in restaurants, but tell me your thoughts.
Yeah, well, I think it's kind of hard actually to do the social distancing. I try to get outside some with my teenage boys, and just even on the normal fire roads. If I'm riding my bike, there's a lot more people, so it's not that easy. And the more dense uh, place you're living, especially the city, Oakland, the harder it is to really keep people away. And people are still, breathing in, breathing out, exhaling, and there's probably some virus in the air. So I think it's harder than people imagine, and it's just not that easy.
The president has the power to compel companies to manufacture masks and protective gear and ventilators. Your thoughts on that?
Well, I think that needs to happen. Um, and I think that there was lots of opportunity um, as far back as December for the administration to compel companies to um, be ready to ramp up production of testing, for example, um, and even masks. These are known um, items that are going to be in short supply. So um, yes, they should do it now. I think we're going to have to get creative about personal protective equipment for the time being, and we're rationing. So that makes the frontline staff um, more anxious. But because every hospital in the country is short on PPE, it's not really possible to have enough before this all starts. So I'm wondering why we didn't have a stockpile of 20 billion N95 masks. But I think that if we all realize we're in this together, and we start mobilizing uh, private sector in conjunction with public health, using things like 3D printing to make items that are in short supply, then I think we can improve the situation. There's a lot to do. I would have liked to have seen a preset um, plan, defense plan in place before all this had happened. A pandemic, emergency response plan that could be activated in the event of a pandemic, where there was already contracts ready to be activated with companies like Gilead or um, and Merck and some of the other Bay Area companies, such that they could switch to producing things that we needed in mass, but immediately, and have a business incentive to do that. And that didn't happen. And it's not easy for leadership to hear people like public health experts say, and in fact, it's going to happen. It's kind of like saying, well, next year we're going to have an 8.2, earthquake. Um, it's something it's a little hard to wrap your head around unless you've seen it.
Yesterday, I spoke with a chair at Columbia University's hospital. I think it's New York Presbyterian. And he told me that that hospital, with its 2,600 beds, is overwhelmed. Is Marin General experiencing that? Is the Bay Area experiencing that? What are you hearing?
No, I think some of this is luck. Some of this is social distancing. Um, I'm a little surprised that it's coming up pretty slow. So MarinHealth Medical Center is not seeing that, but we're certainly seeing some impact in the emergency room, and we've been aggressively preparing for this for at least a month. But it's the density in New York and even in San Francisco that where you have a lot of people touching the same things, breathing in the same airspace that contributes to this. So I would have, if I was in control of public health in New York, I would have, had the shelter in place a couple of weeks before they did, and they knew they had an outbreak north of the city. So I'm a little surprised at how long it took, and I think that um, that's one of the problems there in New York. So my heart goes out to all the New Yorkers, and some of the other big cities are just kind of figuring this out too. So uh, it's certainly going to be a battle.
I read yesterday that individual hospitals and medical groups are responsible for creating or proposing their own triage. Can you tell me what is in store for your group when and if you have to make those decisions?
Yeah, so we're trying to prepare for that, and it's just not the easiest topic to talk about. Is triage, but it's something you want to do ahead of time as much as possible. So we've been working on this very hard, um, and um, we have a plan in place basically for it, and we have guidelines we've been working on last night about who uh, who do we want to focus our care on. It's not hard to imagine that we want to make sure we have resources for a 40-year-old woman, a 50-year-old man, rather than an 85-year-old man. So we're trying to get ahead of it and of this difficult issue and reach out to skilled nursing facilities and families, um, and uh, and be proactive about changing, having a discussion with patients and families about changing their code status if they're at 85, for example, from full code to do not intubate. Because one of the big challenges is older people, sicker people who need to be intubated and on a ventilator if they have COVID-19, they tend to stay on the ventilator for a while. And so that's pretty different than normal, where an average patient might be on a vent for 4 or 5 days. So we're trying to plan for that too.
I I think that there's a good deal of fear that people over the age of 65 are going to be in the group that doesn't get the ventilator because there'll be such a demand for people that are much younger.
Well, I hope we don't get there. I That's a really uncomfortable place. We have a lot of healthy 65-year-olds out there who have a couple more decades to go. So we don't we don't we don't want to be there, but we also we're hopeful that the state can give us some guidelines. The state has an emergency management system, so I'm hopeful that we can get guidance from them about how big the surge is, and there's plans to move resources, move patients from one location to another, so that hopefully we don't get there, and we have better coordination and more resources than Northern Italy.
If you had to guess as to when the surge will hit the Bay Area,
Yeah, well, I think it's already started. And I think that if you ask an emergency room doctor, a hospital administrator, it's pretty hard to pin down. It's this, especially if you don't have testing to detect it. So um, I think we've already seen some impacts, and volume in emergency rooms are down to the general volume. But anytime somebody comes in with who's a possible COVID-19 patient, a PUI, it takes a lot more resources to keep the staff safe, sort out what the situation is, sort out their risk for COVID-19 disease or not. And the signs and symptoms are vague or non-existent. So it's a huge challenge right now. And it's just going to be a slow uptick, I hope. I hope that there's no big spike like happened in New York, but I can't say. Certainly, we're going to see a lot. Once people have more positive tests. Next week, it's gonna tick up, and it's gonna be more strain on our healthcare system for sure. It is a system.
Greg, I can't tell you how much I appreciate you taking the time to talk with me.
Thank you, Mark.